Good morning, everyone. I'm Cassie Sauer. I'm the CEO of the Washington State Hospital Association, and we're really pleased you've joined us for our media briefing this week. We have a bit of a focus this week on mental health. I read somewhere someone quoting the mental health crisis as being an epidemic within the pandemic, which I thought was a really interesting way to phrase it, but we are definitely seeing more need for mental health services. I want to talk directly about that. We have a terrific panel. We've got Dr. Jurgen Unutzer, who's the University of Washington Medicine Chair of Psychiatry and Behavioral Health. Dr. Unutzer has been a long advisor to the Hospital Association and its members on mental health and psychiatric needs all around the state. So we're really glad to have you here. Dr. John Lynch, who we've had several times before, who's an infectious disease specialist at UW, also at UW Medicine, also a terrific and regular advisor to the Hospital Association throughout the pandemic. Very grateful for all of his wisdom, and not just the Hospital Association, but to hospitals all around the state and region, which I think really want to particularly thank Dr. Unutzer and Dr. Lynch for this, very, very much exemplifying the spirit that we have brought to this pandemic in Washington State, that all the hospitals are working together. We're all in this together, and these two have been outstanding in their sharing of information and wisdom. We have Gordon Oakes, who's the Director of Clinical Support Services at Overlake Medical Center in Bellevue. You will recall that Overlake is one of the hospitals that got first and hardest hit by COVID. So Gordon's been at this for a while. I'm really pleased to have you joining us today. And finally, Samantha Jerome, who is a nurse and leads employee health and COVID-19 response at Cascade Medical Center in Leavenworth. So welcome to the panel. I also want to start by saying, we are planning for this to be our last every other week media briefing. If you all have strong objections to that, please put that in the chat. We feel like things are, I hope we're not jinxing ourselves. It feels like things are calming down, and that we are hoping there's less COVID news in 2 weeks. If that changed, we would resume these media briefings. But if you, again, if you have comments about that, we'd be happy to take them in the chat. Okay, so some opening comments. First, we are at about, as of this morning, it looks like statewide, we are at about 520-ish hospitalizations for COVID, which is a decline. So it is a slow decline, but that is so much better than the fast acceleration we saw maybe 3 or 4 weeks ago. So huge thanks to Washingtonians for wearing their masks, keeping their distance, getting vaccinated, doing all the things that really are making a difference in stopping this pandemic. We continue to face new variants all the time. They are always of concern, but we also know that the same behaviors that prevent the original disease from spreading also prevent the variants from spreading. So really encourage people to continue those. Second, we want to make sure that everyone knows that vaccines are widely available. We are hearing from people that they believe that vaccines are hard to get. That was, which of course they were early on. And so there's a lot of folks who are willing to get a vaccine, but haven't done so yet, just because they haven't had the time or think that it's going to be a real challenge. We want to say again and again, you can get a vaccine anywhere, pretty much anytime. There's usually, you get a same day appointment, a walk up vaccine. So really encourage people to get vaccinated. Another person said recently to me that the salvation is through the eye of a needle, and the eye of the needle in this case is the vaccine needle. So we hope that folks will really take that into account and get their vaccines. Third, kids vaccines are available. I took my 2 kids, I have 3 kids, 2 are eligible. One of them went to Lumen and one went to the Rainier Beach site. Both were fantastic experiences, super easy. Kids were great. My 15-year-old invited a bunch of his friends. It was a couple of days before his birthday. They all got vaccinated together. We went out for ice cream afterwards, kind of a little birthday celebration. It actually was fun. My kids, who act like when they get a flu shot that they're having their arm amputated without anesthesia, were actually enthusiastic about this vaccine because it opens up new worlds for them. So really want to continue to encourage our young people to get vaccinated. I know that most parents are quite excited about the prospect of kids going back to school full-time in the fall, and more vaccines will certainly help that along. Another piece we want to note is that there have been some incidences of people coming to hospitals or clinics either as patients or visitors and refusing to wear a mask and saying the CDC guidance says they don't have to wear a mask any longer. We want to be clear that make sure people understand that the CDC guidance actually says you must continue to wear masks in healthcare settings. So we've created some new signage jointly with the Medical Association and long-term care organizations that we're using in hospitals and long-term care settings across the state, but really want people to understand that they will continue to be asked, whether a patient or a visitor, to wear a mask in hospitals, clinics, all kinds of healthcare settings across the state. And that is CDC required, and the Department of Health followed up with its own order saying that as well. Couple of other opening comments. I want to make sure folks saw a bill that was passed and the governor has recently signed this session. It's Senate Bill 5178, and it addresses the issue of waivers in a state of healthcare waivers in a state of emergency. So one of our goals at the Hospital Association is to try to gain some learnings out of this fairly miserable year and apply those for the future and set up a better infrastructure for people, hopefully for people who come after us, because we don't want to have to go through another pandemic, honestly. But what this bill does is it creates a list of healthcare related laws that would automatically be waived in a governor declared state of emergency. So these are things, we needed waivers to do things like testing of patients for COVID outside of the emergency room, or triaging patients outside of the emergency room, setting up the drive-through vaccine clinics, providing care in unusual places. So those are some flexibility in how pharmacists or medical assistants work. Those are some of the things that we think in any healthcare related state of emergency would be very important. So we're really pleased the governor signed that bill, and it will just create this a much faster trigger for those laws to be waived, and a much more nimble response from the healthcare system. Then my final comment is that something we're seeing around, this is not COVID, but it's related, in hospitals around the state, is that the acuity of patients, which means how sick they are, is going up. That means patients that are coming to hospital are sicker than they were a year or 2 years ago. And what we believe is that people are delaying care, that they think either hospitals are too busy with COVID, or they're concerned about going to a hospital setting, and they're coming in much, much sicker, which makes it harder to treat them. And so we really want to encourage people to not delay care for, if you're feeling symptoms of, if you've got chest pain, or you're feeling dizziness, or, whatever the issue is that is of concern, to please get to your doctor or your hospital or your emergency room or urgent care sooner rather than later. Okay, so with those opening comments, I will now turn it over to our panelists. So I think, Dr. Unutzer, I'd like to start with you to talk about the mental health issues that you're seeing throughout this pandemic.
Great. Well, I'll make a couple comments. First of all, Cassie and WSHA, thank you for thinking about mental health in the context of the pandemic. I think that, for the most part, you summarized some of the really good news we're all seeing now. Being able to have our kids get vaccinations, I think, is huge. So I think that's a big, sign of hope for all of us. I'm going to call out sort of two, what I think of silver linings in the context of the epidemic. I'm a glasses half full kind of person, so I always look for, is there something good in all this terrible stuff that we're going through? And I would say, I can think of two right off the bat. I'm in psychiatry, I'm in behavioral health. We staff about 200 inpatient beds around the state. And I would say, I think somehow magically the people in our business have thought, things like infectious diseases probably happen somewhere else. They don't happen in our setting. So it's been a challenge for us to get people to wash their hands, to be, mindful of the fact that when you're dealing with a person who's hospitalized for even just a non-medical problem, you still have to think about those things. And the pandemic has pretty well taken care of that. I think we've all learned now how to safely practice. It has been challenging because if you think about a typical psychiatry inpatient setting, it's different from medicine and surgery, where people are sort of mostly tied up in their bed. In a psychiatry inpatient setting, people are in their street clothes walking around a ward. And if they could have COVID, that makes the management really pretty challenging. So I think we have all learned a lot about that. The other thing I would say, that I see as a real silver lining is, people are now more comfortable talking about mental health. In the midst of a huge universal stressor that has come at all of us, across the state, people are okay saying, "Are you okay? Might you be having stress? Might you be, having so much stress that you should get some help?" And that's not just true for our patients. That's also true for ourselves, our healthcare providers. It has been super stressful, and although it is a universal stressor, obviously some of us have experienced it in different ways from each other. So it matters if you're in the inpatient setting, the outpatient setting, if you're in an emergency department. But I guess what's unique about us as healthcare professionals, we had the stresses that everybody had, and we also had the stress of continuing to have to come in and work with our patients. And so what I would say I saw over the course of the pandemic is, early on, a lot of anticipatory anxiety. People were just, almost paralyzed, some of them, by how is it going to be? How am I going to be safe? How can I come in and do this work? And once people sort of figured out with, the tremendous help from people like John Lynch and others who sort of taught us how to practice safely, that we could do it, a lot of that anticipatory anxiety sort of went away. But then we started seeing, individuals who were affected, or a family member who was affected, people who had, huge disruptions in their lives, who had truly traumatic experiences. I worked with a couple of healthcare professionals early on who had exposures, and it was really traumatic for them, and they almost became unable to function, to practice. And that looks a lot like any kind of post-traumatic stress disorder, when you start being able to say, I can't even function in my day-to-day. And that requires more than just supportive conversations. That requires somebody who really knows how to help somebody like that come back out of their shell and go back at it. And then I think what we've seen as things have worn on, first of all, I would say in general, people have shown to be remarkably resilient. But it is true that a year in, we see a fair amount of burnout. We've had a good number of healthcare professionals retire who have said, that's enough. This is the time for me to get out. And we now have a good number of people who have gotten comfortable working from home or working partly from home. And I think we're going to have an interesting challenge coaxing some people back out into the workforce. And we have some pretty serious staffing challenges. I think we are now seeing, in all of our hospitals, a fair amount of pent-up healthcare demand that's all coming back at us, and we don't quite have the staff that we would like to have. So I think there are some challenges related to that. But I think overall, it's really is important that we have acknowledged that this is hard work, this is stressful work, and you might need a supportive conversation with a peer. We've done that here at UW Medicine. We've had a whole bunch of peers who've done a wonderful job offering just supportive conversation. You might need a little bit more than that. You might also have more of an issue with an addiction problem that you might like to admit to yourself. So a lot of people have coped by either drinking more or trying something else to help them go to sleep, and that can catch up with you after a while. And so now we have a number of providers and family members and others and some of our patients where you have to have a conversation about, might you be drinking a little too much? Might this be getting in the way of you moving forward? And could you use some help with that? So I think lots of challenges, but also a wonderful way of people being willing to talk about mental health and reaching out to each other. And some really great opportunities for us all to help each other move forward. So I'll stop here for now.
Thank you, Dr. Unutzer. Gordon, would you like to chime in here on work that you all are doing?
Gordon, Can we just have you on mute?
Unmute.
Great.
How are we now?
Perfect.
Okay. Yep. I said brilliant things there in the few seconds there that I was muted. No, thank you very much for the invitation this morning. I'm the Director of Clinical Support Services for Overlake Hospital, which is a 349-bed nonprofit center in the Bellevue area, as many of you are aware. Director of Clinical Support Services. I'm a pharmacist and Director of Pharmacy and oversee respiratory laboratory clinical research. They already knew I was a little bit crazy, so they asked me if I wanted to head up the vaccine program for Overlake. And so October of 2019, starting this all up, October of 2020 and into December, first vaccines were given on campus in our on-site clinic. And then we were very fortunate to have Microsoft and Starbucks reach out to Overlake in January, along with our partners at Evergreen, asking us if they could help us by supporting a mass vaccination site. Little did I know that the planning that ensued over the next 3 weeks would result in vaccines being given at the King County Vaccination Partnership site at Microsoft in Redmond in February. So it's been an amazing partnership. To date, the partnership has given 142,309 vaccines on site. And now, as we're approaching some of the vaccine hesitancy that we're seeing, you know, we haven't vaccinated as many of the 12 to 15-year-olds as we'd like to. Of course, as was commented on a glass half full, right now we've got twice as much glass as we need. We're actually chasing people with vaccine, and we're happy to do that. My partners here at Microsoft, we are now getting ready to pivot to mobile vaccinations. Our care van, so to speak, which is a tried and true methodology that's being used across the country. We're figuring out how to scale this site down, not completely, but so that we can ramp it back up as boosters and as other age groups are approved. But really getting out there to move past vaccine hesitancy by moving to the pockets where these people are in our community and making it so easy to get vaccinated that you really are without excuse. Really looking to our media partners and others to assist in that communication. You know, from a mental health perspective, I don't think there's anything that you can do for yourself better to ease your mind than to get yourself vaccinated, so that that's one less thing to worry about. And from a provider standpoint, those providers who've engaged and volunteered in this effort here in King County Vaccination Partnership site, as well as other sites, it's darn therapeutic. You are, when the vaccines came available, for the first time, we were on the offensive rather than the defensive. So amazing. It's been amazing work, partnerships with Department of Health, with Public Health Seattle King County, with Microsoft, with Starbucks, with Evergreen. This is, you can see the gray hair. This is a capstone, a career capstone, something I will never forget, being engaged in a battle like this. The battle, the faces of the community walking through this site, every creed, color, ethnic group, a cross section of our community, nervous as they're coming in, the smiles as they're heading out, that they've actually accomplished it. And boy, you can see the ear-to-ear grins on the folks who have finished their second dose of the 2-dose products, or the J&J folks that one and done. They're relieved, they're happy, they're glad to be done. And as I like to say, I'd like to take a vacation someday, but I'm not taking one until we get rid of these masks that we're wearing. So I'm all in, the site's all in, the partnership's all in. We're going to keep battling with this as long as it takes. I'll turn it back over to you.
Thank you, Gordon. And if folks haven't had a chance to see that vaccine site, I know you all welcomed media there. It's a cool one to have a look at.
Absolutely.
Dr. Lynch, we'd love to hear from you about what you're seeing in cases and acuity and advice to folks about what they should be doing now?
Yeah, sure. So thanks for having me on. And I really appreciate your leadership, Cassie, and the Washington State Hospital Association throughout all of this. It's really, I think, like you said, a great testament to how we've all come together in Washington to deal with this, pretty bad, no good, not good year. So within hospitals, within UW Medicine, and I know talking to my colleagues across the state, and as Cassie mentioned, we continue to see a lot of patients. Our hospitals are extremely full. We continue to have patients with COVID-19 who are either on our acute care floors, that's your kind of normal hospital floors, but also in our ICUs. And unfortunately, we continue to have a large number of people, particularly in those ICUs with COVID-19, who are just taking very long periods of time to get better. We know from the beginning that people with critical illness and COVID-19 take, just a long time to recover for those that can. And unfortunately, we continue to see deaths due to COVID-19 right up till now. Within my own county here in King County, we're still seeing 1 to 2 people die per day. And this is happening within my hospital. We just lost another patient this weekend who was young, who had a family, and it was all due to COVID-19 illness in the ICU. So hospitals are full, lots of folks putting off care. We still have COVID-19 patients throughout our region. But the good news is those numbers are slowly trending down. They're heading in the right direction, and I think are really a reflection of the decreased number of cases we're seeing in the community and across the state. So as cases come down, hospitalizations come down, and hopefully we'll see fewer and fewer people getting infected, hospitalized, and at the end, fewer deaths. So the hospitals are full, busy. As Cassie mentioned, I think working through some of the recent masking stuff that's come out, and I think just making sure that we're messaging our communities around engaging in full masking as we start to slightly reopen many of the things that we do within healthcare. Within UW Medicine, and I know, again, many health systems in our area are re-engaged in, for instance, visitors in coming to see patients. We know many of the positive aspects of having visitors in our hospitals. But again, asking them to make sure that they continue to follow all of the precautions that are absolutely necessary in particularly vulnerable populations like in the hospital. The last thing I'll say is that, many health systems, as Gordon just pointed out, are very, very engaged in vaccination programs across the state and have done just incredible work and will continue to do so. So lots of good news around vaccinations. Good news around re-engagement with things like families and friends and visiting patients in hospitals, but still a clear recognition that our hospitals are quite full, not only with some COVID patients, but more importantly, all the other people who've required care across the spectrum of need. Over.
Thanks, Dr. Lynch. I saw, I don't know if you saw this, it might have been this morning, that UW Medicine put out an interesting research paper about COVID that recommended that folks who are diagnosed positive with COVID get themselves either borrow or buy a pulse oximeter and track their breathing respiration rates, and that there was a real awareness of that was very helpful in helping people figure out when they need to get hospital care.
I haven't seen that paper, but this is actually a discussion we've had since I think last spring. Mm-hmm. We basically learned that there's this disconnect between how people feel and how severe their illness is. And so people can feel okay, but they were actually, their oxygen levels were actually much lower than the way they felt. There was sort of this disconnect. Typically people who use these pulse oximeters, right? When we measure your oxygen levels in your blood, right? We want it to be above 90%, but many of these people are in the 70s and 80s, which is very low levels of oxygen, but they felt okay. That is very unusual, and it's nice to see if there are data out there. Again, I'll have to take a look at it. I know some health systems were actually giving out pulse oximeters last year in the outpatient setting. I don't know how widespread that became, and it's nice to see some data coming out of it. And if it's a good recommendation, we can get these pretty inexpensively to folks and get them out there as good tools.
Yeah, thank you. All right, great. Thank you. And finally, Samantha, we'd love to hear about how, from the Eastern Washington perspective, how things are going, vaccination rates, what your cases have looked like.
Good morning. Thank you so much for having me. My name is Samantha Jerome, and I'm over here in Ashland County at Cascade Medical Center in our hamlet of Leavenworth. And things are actually going pretty well. Our cases have plateaued and they are starting to decrease. We do still have some people hospitalized down in Wenatchee with COVID, but it's looking better. Our vaccination rates are, our campaign here has been really successful. We have a mass vaccination center just 25 miles east of here at the Town Toyota Center in Wenatchee. And we're doing really well, I feel, with our vaccinations in our region, which is wonderful because it's one of the things that brings hope to our staff. And that's one of my roles as I'm employee health here at Cascade Medical, as well as COVID response. We've had great collaboration with our local health jurisdiction, as well as Confluence Health and Lake Chelan Hospital and Columbia Valley Community Health as well. So we have been meeting weekly and created a great collaboration and open communication, which is, I think, has served our region particularly well. One of the things I will say about mental health is in the beginning of COVID, we were really focused on physical health of our staff, PPE, making sure we had enough, creating our protocols, and that anxiety about the unknown was, it became clear very, very quickly. So we had to have lots of open conversations about that, a lot of listening. And the other thing was, the next thing that kind of happened with our staff was in the fall when our kids needed to go back to school. There was a lot of anxiety from our parents, and that's actually what I heard most of the feedback about from our staff is my kids and the concern about their families and how they were going to navigate all that. But I do see a great amount of hope with the vaccine. We recently did a vaccine clinic at Cascade High School, and about 25% of our slots were full until Pfizer approved with the EUA for the 12 and above. And then we filled the rest of our spots, and it was really great. And so our families are more hopeful, our staff is more hopeful, but we still are, concerned.
Great, thank you, Samantha. That's exciting to hear that you've got the 12 to 15s coming in for vaccine. Really, really thrilled to hear that. I want to provide a clarifying comment, and thanks to someone on my staff who said that I did not expertly describe 5178, the waiver bill, what it does. I think I didn't say this clearly enough. Is it sets up a clear process for the governor to consider whether an emergency impacts the healthcare system, and then gives the governor 5 days to decide yes or no on a waiver of a core set of hospital laws. And so this was something that we hope will be in place for, again, we'd like to not have to use this law. We hope people 25 years from now will be, or 100 years from now will be glad that we worked on it. Okay, so let's get to the questions. First, a question from Nick, which I hate this question. I don't think I had really thought about this. So this question is, Memorial Day led to a surge in COVID cases last year, but it doesn't appear to be the case this year. Are we concerned about Memorial Day weekend 2021? And I honestly had not, last year we were very concerned about Memorial Day. I still am. I mean, anything that gets people together in groups, especially if they're unvaccinated. Dr. Lynch, would you like to comment on this and your feelings about Memorial Day?
Yeah, I mean, honestly, I haven't thought about it much for some reason so much this year, so I'm glad you brought it up. I think that Memorial Day is naturally lends itself to gatherings. The things we have in the pro column here is vaccinations, right? We're dealing with a far different population in Washington State around vaccination, but we're still not quite, where we need to be around mass gatherings. When I look at the Washington State data and I look at the number of completed vaccinations, we're still right around 40% for total. If you just look at everyone, not just eligible. And so we still want to get a little bit farther. When you look at what happened in the UK and Israel, it's probably in the 60 to 70% range where you really start to see the big impact in the levels of protection from circulating virus. So the thing I always remind people of is Washington State has actually done a great job with keeping people from getting COVID-19 over the last year. And what we really don't want to do when we're so close to getting to that high level of protection with vaccination is to sort of take off all of the, stop all the things that we've done to keep everyone safe. So my recommendation, as I think about it on the fly here, is that treat Memorial Day this year a lot like we did last year, except for those folks who know that they're all vaccinated, right? If you have a mutual group of people where everyone is vaccinated, I think that's a different situation than last year. But for those folks who are not yet immune, I think thinking about it like we're still to some extent in the trenches on this, like we were last year, that will keep all of us safe and keep people from ending up being in the hospitals.
Thank you. And can you remind folks of, I think this is a interesting to think about. We have lower COVID infection rates, which is fantastic, and also makes us more vulnerable. Can you describe that phenomenon?
Yes, and so it is sort of a tricky sort of thing to think about, is that when we look at our population in Washington State, and I talked a lot about this when we just started up our vaccination for the public, right? The vaccination campaigns. And people are saying like, let's just, if once we get vaccinated, we're all set. The issue is that most of the people in Washington State have no immunity to this virus, SARS-CoV-2. They have never seen it, right? And so that means that they are vulnerable to the infection, just like all of us were before vaccination started. And so what that means is that we're in this sort of tricky transition, whereas activities open up as masks get removed, especially if you're not immune, you are going to be around a lot of other non-immune people, right? And so lots of non-immune people, because we've been so successful, leads to a bit of a risky transition. And, one of the questions I've been asked in some media opportunities is like, you look at some other parts of the country that opened up earlier. Well, if you look at their rates of infection, they're often 2 or 3 times higher than ours were last year, right? 2 or 3 times more people got infected, 2 or 3 more times people died because of different approaches. And I think we want to maintain our success until we get everyone to that level of immunity that keeps them safe.
Thank you.
Does that make sense, Cassie? I hopefully
Yes.
I captured it.
Yes, thank you. That's great. Okay, another question. Do we know, I'll send this to Samantha and Jerome, do you know of any cases where immune compromised people are being given 3rd doses of vaccines as part of a study or to boost their own immune response? I have not heard of this.
I have not heard of this either. I don't think we have those recommendations at this time. We're currently, it's just a 2-dose series for the mRNA vaccines.
Anybody know about this?
I don't know of any studies that are ongoing around adding a 3rd dose for the Pfizer, Moderna, or a 2nd dose of the J&J, but there are lots of studies looking at mixing and matching vaccines, what's called heterologous boosting, where you take one vaccine and give another. And I'm hoping that some of those combinations may have a bigger impact for people who are immunocompromised, because right now, those folks, even if they're vaccinated, they're really counting on the rest of us whose immune systems may be intact to keep them safe, right? And so until we know more, I don't think we can make that assumption.
Thank you. Are we seeing a direct correlation to areas with lower vaccination rates and hospitalizations? Yes. I think that's what you're seeing with the outbreak up in Ferry County. The vaccination rates are quite low, and they've had much more infections there, and a lot of patients that have had to be airlifted out of that community to other hospitals around the state. So it may not be hospitalizations in that community, because in many cases they're smaller, more rural communities where the vaccination rates are lower. So when people get sick there, they actually end up being hospitalized. If they're really sick, end up being hospitalized elsewhere. But that's definitely causing infection that leads to hospitalization. Anybody else want to comment on that? Or disagree? You're welcome to disagree. That's what we're seeing. Okay, Dr. Lynch, a question for you on the childhood vaccinations. What are the concerns, the rare occurrences of myocarditis showing up?
Yeah, so folks may have seen some of this in the media over the weekend around this concern about myocarditis happening after COVID-19 vaccination. So first, what is myocarditis? It's basically an inflammation of the heart muscle. It can be caused by lots of viruses. And in fact, this time of year is sort of when we start to see a few of these cases. There's about 10 to 22 per 100,000 cases of myocarditis that we see every year. It's something that's not, it's rare, but is definitely something that's on pediatricians' minds and adult doctors' minds and infectious disease doctors like myself. So it does happen. We know from Europe that there's been some reports and some concern of this happening after some of the vaccines have been giving out there. And I think that the media now, as reported over the weekend, is that we're starting to see some cases of myocarditis happening in the United States. The first thing to know is that the numbers remain extremely low. And yes, some of these are happening after vaccination, but just like everything else, we know that things happen after vaccination that would have happened with or without that vaccine, right? So people have medical problems and surgical problems that occur around the time of vaccine as well. So it is incredibly important that we capture all of these cases, that we are coordinating with public health about reporting them, and that we're trying to make sure we understand what's actually happening. Because if there is an association with the vaccination, right, that's important to know. And I think is actually would be a testament to how much surveillance is going on, right? Surveillance through the VAERS reporting, communication with public health authorities around all these things that are happening. And we saw this happen with the thromboses events, right? Remember from a few weeks back. And then to understand what's the risk-benefit scenario. So the first thing is very low numbers. 2, demonstration of how effectively we're doing surveillance. And 3, we don't want to make any changes to our vaccine approach in any age group until we know there's causation, until we can develop a risk assessment if there is anything there. So yes, we are seeing cases. We are seeing some cases in Washington State that are happening after vaccination. And what we're doing right now is working extremely hard with local state, with Washington State Department of Health and the CDC to get those cases to them so they can do the analysis and investigation to see whether there's any true causation, any true connection between vaccination and these cases of myocarditis. I'll also point out some of the, many cases of myocarditis are actually pretty minimally symptomatic, and some people probably just resolve on their own, whereas others can be a bit more severe.
And Dr. Lynch, we also know that myocarditis can be caused by COVID.
Great point. Thanks for reminding me there, Cassie, is that absolutely. So getting COVID is definitely puts you at risk for developing myocarditis. And so vaccination, right, especially, right now, vaccination actually protects you from getting myocarditis due to COVID-19. And we know that's the true power of many other vaccines that we use.
Thank you. Okay, another question for you, Dr. Lynch. Are we seeing that immunity from vaccines is stronger than natural immunity, or asked differently, how important is it for people who've actually had COVID to go ahead and get vaccinated?
Right, so I can't give you exact numbers, but looking at all the research that's out there, absolutely, vaccination provides better immunity than natural immunity. We know that reinfection can occur, it's uncommon, but definitely can occur in people who have had natural infections due to COVID-19. But we look at the rate of infections following vaccination, whether you've had COVID-19 before or not, is much lower. And so what we really want people to do is to get vaccinated as soon as they recover from their COVID-19. You may recall that there was this ask for people who had COVID to wait 90 days early on. That was a supply chain issue. And Gordon can certainly comment on this as well. But that was really about, we wanted people who had COVID, they probably were immune for several months at least. And we wanted people just to hold off, that group to hold off until we had enough vaccine. That is no longer an issue, as Gordon mentioned. And so as soon as you finished your isolation period from COVID-19, just 10 days, right? Plus your symptoms are better and no fever for a day. Once that's done, you can go right off to a vaccine site and get vaccinated safely. And that's going to provide you with the most powerful, longest lasting immunity that we're aware of.
Great, thank you. And as we said, you can get a vaccine just about anywhere, anytime. That's all the questions that we have. I'm happy for other folks to put questions in the chat or ask them orally right now. Okay, so
maybe I'll make a quick comment just to actually follow up on something I think Gordon said. So from a mental health perspective, getting yourself the vaccine is the single most powerful thing you can do right now. Getting it for your kid probably right after that. Helping somebody else get it probably right after that. I do appreciate John's comment on the concerns about heart disease, because there is a fair amount of concern now about, the kids don't get that sick if they get it. Do you want to take the extra risk? And I agree completely. The best thing we can do is very, very quickly, and we'll need all the hospitals and everybody to report this data well, very, very quickly figure out, is there really significantly increased risk? Or if you put it all together, if you think about the risk of getting it with COVID and all of that, it probably likely is still the best thing to do, but figuring that out very, very quickly. Because I think people are now going to, some people are going to wait with their kids because they're going to say, let's see how this plays out before I make that decision.
Thank you. And we actually just got a bunch more questions in about ICU capacity. What does that look like statewide right now in regard to the governor's new reopening guidelines? As Dr. Lynch noted, hospitals are pretty full right now with COVID and a lot of not COVID. And that's part of what my opening comments about asking people to seek care earlier if they're feeling symptomatic for something that is worrisome, to go and get it checked out, because what we're seeing is people are delaying care and it's causing them to be sicker and need more, for example, ICU care. Anyone else want to comment on that?
Yeah, I just think that we should keep pushing the message out that hospitals are safe. Hospitals and clinics are safe. These are the places that have taken all the measures and are maintaining the measures as we've done for the last year. The masking, the distancing, the ventilation that we know is so critically important. Those are all happening and will continue to be in place for the foreseeable future. We want to keep people safe, and the main message we want to get out as healthcare workers, as healthcare providers, is that this is a safe place to come. Please get your regular care, your preventative care, your routine care across the spectrum of need. We don't want to wait for people to wait until their treatment is going to be more complicated or more severe, or they're going to suffer. We do want to continue to provide all that care that we've all worked hard to maintain. That's really been one of the most important things over this last year, is how do we keep health systems open? How do we keep clinics open with all this? And it's for people to get their care, and we want to do it. So please do send that message out. Thank you. Thank
you. And I would say you're safer in a hospital than you are at a Memorial Day barbecue with unvaccinated people by a lot. How much concern is there about those that refuse to get vaccinated in the variants? Are there enough getting doses to win the race against the spread of the variants? Gordon, you want to take a stab at this?
Well, everything we're seeing right now would indicate that the drugs that are available right now are covering the variants. So for goodness sakes, get vaccinated. You know, if you're not fond of the externally worn protective equipment, the masks and the social distancing, get the cellular or molecular level protective equipment. That's the vaccine. Get it.
Anybody else want to comment about that?
I'll just mention, and follow up on Gordon's comments, if we look at all the variants that we're worried about, right? The B117, 1351, P1, 1427, and 1429, and even the one that was first described in India, the 1617.2, the vaccines that we have in play right now, the Pfizer, the Moderna, and the Johnson & Johnson, are effective against all of them. These are incredibly powerful tools to prevent these variants of concern from continuing to spread. I will also point out, though, that if we have large populations of people who are unvaccinated, either locally or globally, more variants will arise. And it is really, you know, our responsibility to push vaccines out to every person on the planet, so to provide them with the safety that many of us are now currently enjoying. But as long as, you know, from a different perspective, if we don't do that, our vaccinated population is going to probably be dealing with more challenging variants in the future. So right now, not a big issue. We're doing great, but definitely something we have to continue to think about.
Thank you. And I was going to comment on that as well about the global vaccines. There's been some, actually, I find kind of surprising controversy in America about why should we be giving vaccine to other countries. And it seems, first of all, from a just pure humanitarian point of view, of course, we want to get as many people vaccinated to prevent disease and suffering and death around the globe. But from a purely selfish point of view, for other parts of the world to have vaccines so that they can't breed variants that could come back here, it's exceptionally helpful to us. So we are all in favor of a global vaccine campaign and in sharing the wealth of vaccines that the higher income countries have with lower income countries, and making sure that we're getting as many global citizens as possible vaccinated against this disease. Dr. Lynch, another question for you. On the myocarditis issue, is there a concern that parents will use this concern as a reason to not get them vaccinated?
Yeah, I think I'm not a pediatrician, just to be clear, but I think that is the concern. I think as I said, we went through this with the central venous sinus thrombosis cases that were described about a month or 6 weeks ago. And so when parents, start seeing these reports of teenagers with heart problems as a result of, that may be linked to vaccination, it's understandable, right? That's what parents' job is, to keep their children safe. And so they may hold back. That just slow things down. And we saw that happen with the J&J vaccine as well. And that is, again, why, as Jurgen mentioned, is why it's so critically important that we move very fast to collect all the cases that are happening and investigate them as quickly and as thoroughly as possible. So what I can tell everyone on this call is that in Washington State, thanks to the great relationships we have across the hospitals and with public health authorities at local and at the state, we are collecting every case we can find. We're talking about it every day, and we're getting all that data to the CDC, and conversations are going on with them as well, so that we can review the data and figure out whether there's truly causation, right? Is the vaccine associated with a higher risk of myocarditis, or is it something that's just happening independent of vaccination? And so we got to get this figured out as quickly as possible, so as we make sure we're doing the right thing, that we're giving people and parents and children the right information so that they can make a good decision around vaccination.
I'll say, I'm still glad I got my 2 kids in this age group vaccinated. Dr. Lynch, you've got 2 kids in this age group as well?
Yep, I have 2 teenagers vaccinated, and the very first day was available. And I feel very confident based on what I've seen so far.
Yep, great. I think, it's, as we've noted before, the Washington State hospitals are incredibly collaborative. The State Department of Health has been really supportive, and we are working very closely with them, and medical professionals working very much together to invest throughout the vaccine, to see anything that we want to be sure needs to be reported. All right, any other last comments or questions?
I'll just point out for the journalists that it's important to recognize, and maybe you already have, is that there is more surveillance of this vaccine than any vaccine in history. And so it is not surprising that we're seeing rare events being picked up and maybe rare series that need to be investigated. And again, I think it's really a testament to the incredible amount of attention to these vaccines, and which is fantastic, right? All interventions, all medical interventions have potential side effects or adverse events, as we like to say. And we always want to balance those against, as Cassie mentioned, the dangers associated with the thing we're trying to prevent, in this case, COVID-19, which we all know can be very severe across all ages. And so again, when you look a lot, when you look very hard, you see more. And I think this is potentially an example of that. So more to come in the very near future.
And as you've described, we've seen a lot more young people be very sick or even die. You mentioned the patient that you had this weekend, a young person with a family die. That's happening around the state. People in their 20s, 30s, and 40s becoming very ill and either dying or having permanent, maybe not permanent, but very long-term debilitating effects of this disease. And I think another piece about the vaccine is just to remember that mRNA vaccines have been in development for years and years. They've been used for other coronaviruses. This particular vaccine is new, but the fundamental concept behind them is not. All right. Well, we have the comments about, are we going to continue or discontinue these briefings? People are saying if they continue with, you'll be here. So we'll talk about it. We might change the frequency and maybe do them every 3 weeks or every month instead of every 2 weeks. But as I said, if something big is happening, some sort of feels like really big new news, we would definitely do one sooner than that. but we will be in touch with you about that. Looks like we've gotten through all the questions, and thank you so much for joining us as always. Thanks so much to our panel, Dr. Lynch, Gordon, Samantha, Dr. Unutzer, for being here today and for your service to people across the state. We really are very grateful for all your work.